Welcome everyone. Thank you for coming today. I'm Theresa Marentette, CEO of the Windsor-Essex County Health Unit, and I will start again with our daily updates. We now have 2,091 confirmed cases of COVID-19 in Canada and 503 cases in Ontario. Chatham-Kent has 2 cases. The state of Michigan now has 1,328 cases, with 411 cases in Detroit. To date, we have 3 confirmed cases of COVID-19 in Windsor-Essex County. Overall, 500 individuals have been tested for COVID-19, and of those tested, 329 tests remain pending. These numbers reflect the total amount of testing done in our community, including Windsor Regional Hospital's COVID-19 Assessment Center at the Olette campus. Test results to date have taken up to 7 days. Please continue to visit WECHU.org for the most current information. With the latest announcement from the Government of Ontario on closures of non-essential businesses, I'd like to take a moment to thank those in the health sector, our first responders, our police, our firefighters, our EMS staff, social services, utility providers, and every one of you who are out there to ensure that core services are maintained. Thank you all. If you have traveled out of Canada and are feeling unwell and need to seek a health assessment for COVID-19, there are 3 options available. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone assessment or a virtual assessment if that's available. They will guide you for next steps, including contacting public health or attending an assessment center. Only people with COVID-19 symptoms will be tested. The criteria for testing remains a person who has fever, cough, and any one of the following within 14 days prior to the onset of illness: travel outside of Canada, close contact with a confirmed or probable case, and close contact with a person with acute respiratory illness who has been to an impacted area. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Thank you. Good morning. As we are getting more cases in our community, it is important for all of us to be extra vigilant and follow the public health recommendations to prevent and limit the spread of COVID-19 in our community. We heard it from our Prime Minister, our Premier, and many area residents that some people are not following social distancing when they are outside in the public. Some individuals who should be self-isolating, but they are not. I'd like to remind everyone that it is absolutely important for all of us to follow these public health recommendations to ensure the safety and well-being of yourself, your family, and the entire community. The safety and well-being of your community depends on you. On the same note, I also want to urge the employers in all the Windsor and Essex to ensure that they're still following the public health recommendations when it comes to social distancing, environmental cleaning, regular screening and monitoring of employees' symptoms, and excluding them from work due to travel, and using appropriate personal protective equipment as needed. COVID-19 caused significant morbidity and mortality among individuals over the age of 60. And individuals with immunocompromised system due to underlying medical conditions such as asthma, diabetes, cardiovascular diseases, cancers, and others. Patients who are in acute care and long-term facilities are among the most vulnerable to COVID-19 due to their age and compromised immune system. In the light of vulnerability of patients in these settings and the risk of COVID-19 spread in these institutions, I'm strongly recommending that all healthcare providers, especially those who work in long-term care homes and are employed in multiple settings, to restrict to their work to one institution during this COVID-19 pandemic outbreak. All the workers who are on who work on multiple institutions should work closely with their employers to make arrangements for them to work in only one institution. This will help to prevent the potential spread of COVID-19 from one institution to another. Windsor and Essex location and proximity to Michigan brings unique challenges for our community. The US and Canadian border continues to be a concern for the Windsor-Essex residents and also for the health unit. While the announcement of closures of all non-essential workplaces in Ontario is helpful to mitigate the risk for Windsor-Essex, but it does little for many residents who are employed just over the border in Michigan. 2 of the cases in our area was travel related to Michigan. The number of COVID-19 cases in Detroit is slightly less than the number of cases in the entire province of Ontario. We are concerned about the potential of continued travel to and from work of our residents to Michigan. We are requesting stronger actions by all levels of governments to put together strong measures in place and restrict cross-border travel for our community. All of us are in this together, and we must work together to prevent the spread of COVID-19 in our community. Remember to practice social distancing, wash hands with soap and water thoroughly and often, cough or sneeze into your sleeves or tissues. Keep surfaces clean and disinfected. Thank you.
Now we'll take questions from the media. Let's start with CTV.
In terms of that recommendation to healthcare workers, what spurred that on in terms of now limiting them to staying into one institution?
So as I mentioned, the people who are in those institutions are elderly generally with multiple comorbidities or with chronic conditions. They are at risk of developing more severe consequences of COVID-19. Recognizing that staff, if they're going back from one institution to another, there is a possibility that if one of them or one of the institutions get infected later on with COVID, they can spread it to other institutions. The whole thought behind that is we can contain the system as much as possible because those individuals need services, those individuals need care. All of those healthcare workers are providing those cares. It is important, it is essential. But what are we doing to mitigate some of those risks and spreading to other institutions? So I think it is important for them to recognize, it is important for them, for the employers to recognize that there is this risk, and they should be doing everything to prevent and mitigate those risks.
So what's happening now is that healthcare workers are going between different care homes, or what's exactly happening now that this is solving?
Well, there are healthcare workers who work in multiple institutions as part-time or in their weekends or evenings. So its recommendation is around those workers that they should just try and restrict themselves to one institution.
Any questions from CBC?
Yeah, I have a question about what you said that you're calling for other measures across the border. Sorry if I didn't hear that correctly. Can you clarify what you meant? Are you asking for even more measures beyond what is in place right now?
Well, as I said, there are essential businesses operating only in Windsor and Essex County right now, or in the province, but we don't have much control of if people are employed outside of Ontario. They may be required to go to work, so we are asking for some stronger measures to control and limit those individuals crossing the border, because potentially with the widespread community transmission in Detroit and Michigan, they may be coming back or they may be exposed to individuals with COVID-19 and potentially bring it back to the community. So as much as we can do to prevent and limit these individuals from crossing the border, we can better serve the community or better protect the community.
Any questions from the Windsor Star?
Yeah, Dr. Ahmed, so the 3 positive cases in the area, it's a man in his 20s, a man in his 40s, a man in his 60s. What would you say to people who say this is an old person disease and this is only affecting a certain segment of the population?
Well, infectious diseases doesn't spare any individual. It can affect everyone, even a younger infant, all the way up to senior and elderly population. It is out there, and even though younger and healthy people will have a better outcome, they may not develop those severe consequences, but we have to recognize that even when we are not showing those severe symptoms, we can still spread the disease to people who may be at risk of developing severe consequences, such as our parents, our grandparents, or elderly population, seniors in the community. So it is important for us to know that it's not just us we are protecting. We are also protecting our family. We are also protecting our seniors and the community. So it is our responsibility. We are all of us are in this together. We all have a role to play. So it's not just about me, that how it affects me. It's also about how, if I am infected, how I can infect other individuals and maybe produce a much more worse outcome for my community.
And for people in their 20s and 40s, even though they're at a lower risk, they can still suffer health complications as a result?
Absolutely. So as I said, they are most likely to recover fine, but not to say that they will never develop any severe consequences. They can. And I think that's why it's important for them to understand that they have a role to play as well. Everyone is equal chance of contracting the disease, and we all have to work together to ensure the spread is, we are limiting the spread of the disease in the community.
Any questions from AIM 800?
Dr. Ahmed, do you think people are taking this seriously when it comes to self-isolating? There's still people out and about that are coming back from vacations. Your message to those people, do you think they're taking it seriously?
Well, I think what we know is most individuals are taking it seriously. There are always individuals who try to avoid by any of the rules and any of those recommendations. And I'm strongly urging them to follow the recommendations of public health. And it's not just my request, it's the request is coming from all levels of government, all politicians. The county and the city has declared a state of emergency. The premier has declared a state of emergency. These things reinforces the whole idea that why it is important. It is not an easy thing that we're dealing with. These types of events happen once in a lifetime, and people should know that they have a role to play. It is not as simple as any other common diseases that many people experience. The impact and the potential effect on the entire health system and the entire community is significant. We have seen what happened in Europe. We have seen what happened in Italy. We have seen what happened in China. I think people should take some of those messages seriously and do their part in staying home when they're sick. And especially if they're asked to self-isolate, they should self-isolate for 14 days and follow the recommendations of public health.
And one more one, a couple weeks ago, I think it was, or a week ago, you held a news conference at the city and you talked about the increased calls to help you as you been receiving. What has it been like the past, since that time, I guess, to now? Have the calls increased even more?
So we continue to get calls about COVID every day. We do have a staff of public health nurses and other staff answering calls, answering emails, and trying to answer all the questions that the public have. We have also redesigned our website, and it has a Q&A for each of the segments there, and we're going to continue to populate it with the most frequently asked questions to help inform the public and make sure they get the answers they're looking for.
Thank you.
Any questions from Windsor-Essex.ca?
Are there any updates on the lab in London? Those still open?
So we heard from our hospital partners that the lab in London is operational and functioning, and that should help to reduce the turnaround time for all those specimens. Majority of those specimens that we have sent last week is still with the London lab, with the Toronto lab, and we are starting to get those results back. But there may be a delay by the time when the London lab is fully operational and functional. When it's functional, we hope to get the results back within 1 to 2 days.
Just to follow up on that, any idea when that might be in terms of it being up at full capacity and taking on tests and spitting out results?
I don't know the specific details about their capacity and the amount of specimens that they're getting, but my thought is now it's spread out into different communities. We should expect to see a significant improvement in the turnaround time.
So as of right now, are they accepting specimens from Windsor?
That is my information, that yes.
Is there any follow-up question from CBC?
Yeah, sorry, I have another follow-up on the border comments. I'm just wondering, are you also talking about limiting the provincial border when you said people are working out of province? Are you also talking about that?
No, I think my concern is more from our international border with the proximity of Detroit and Michigan, and the people who are living in Windsor-Essex and crossing the border. So that's my concern.
Okay. And I also have questions about, again, there are more businesses that are being closed, and is all of that resting on the Healthy Edge shoulders to issue fines and orders? Like, I'm wondering, since yesterday morning, have there been fines and orders issued, and can you quantify them?
So the essential business order is for tonight at midnight, and with the state of declaration of emergency from both the city and county, we now have the availability of their resources to enforce directions from the province.
Okay, I just mean there were other businesses that were closed, that were ordered to close as well, like barbershops and hair salons and manicure places, things like that. Have you issued orders for any of them to close? Have they disobeyed that order? That went into effect Monday morning.
Right. So any complaints that we get regarding personal service settings or food premises, they go through our environmental health department and are followed up by public health inspectors. But to answer your question about specific orders being issued, no, there haven't been any orders issued, more of an education, but I believe people are complying. We are getting more reports of people that feel their neighbors have returned from travel outside of Canada and are not self-isolating. So we're getting those concerns, but the businesses, we've been providing the same messages for quite a while now, and they're in compliance, and if not, we will follow up.
Thank you.
I wanted to follow up on some of the border questions as well, Wajid. You had talked yesterday about developing, developing a system to identify, people who are coming over, who might be high risk. Where is that system at in terms of ironing out the details?
I was alluding more to the healthcare worker pieces that are returning and coming here. So that piece is worked at with the regional hospital, and trying to do a risk assessment on all those individuals who are returning back from those travel. And so those risk assessments are happening pretty much every day with respect to what their needs are and their critical needs. Some of the highly specialized nurses and physicians, they cannot be replaced, let's say it this way. So they are putting all those measures in place that when these employees are coming back and working, they are taking appropriate precautions and monitoring, including self-monitoring, taking temperatures to ensure that if they develop any symptoms, they can immediately be taken off from work and isolated. So I think all those measures are in place, and they are being implemented right now, and we'll continue to revisit and monitor all that if situation changes.
And the third case yesterday, you talked about how you were concerned about that travel between the border, and this third case appears to be kind of lumped up in that group. Does that put you on higher alert that we do have a case that's kind of in that criteria? Absolutely.
I think it is important that we recognize that anytime anyone is crossing the border in Michigan with the widespread community transmission, anyone can be infected. So anyone who is coming in contact with anyone in Michigan, in theory, could potentially carry the virus and infect themselves, their family, and also their workplaces. So it is important that we recognize that even if the work is not possible without crossing the border, what else they can do? What kind of government assistance are there? What kind of government measures are in there to prevent them from going across the border? Some clarity around these workers, who should be allowed, who shouldn't be allowed. I recognize the importance of supply chain, because that's crucial, especially in this time, that supply chain need to be maintained. But those workers or those people, they do not come in contact with most of the general public. But anyone who is working in those sides of the border, they have a potential to come in contact with the general public, and we should be putting some specific measures in place to protect our community.
So following that case, does that push you to make any further recommendations that would specifically address what's going on at the border and those travelers going back and forth?
Well, as I said, we're doing what we can do with working with our sectors, our healthcare system partners in Windsor and Essex. I don't have much control in what's happened with the other side of the border, but we are definitely in contact with the Detroit Public Health Department to get some of those details. So anytime if a resident in Windsor-Essex is tested positive while they're in working there, we get our results, we get notified. So I think those measures are in place to make sure that we are not missing any case in our community. And once we are notified, we immediately act on those cases and we try to self-isolate them and then also do contact tracing in Windsor-Essex to ensure that our community is protected.
Any questions from AM 800?
When it comes to the confirmed test, I know Friday came in the evening, Saturday midday, and yesterday midday. Does it vary when the health unit becomes notified? Like, could you be notified at 11 o'clock at night?
Well, depends on if the lab is operating. The moment they have a positive, we get notified immediately. I'm not fully sure about the operational time of these labs at this point, but what we know is if a test becomes positive, we will be notified. I am on call 24/7. One of our staff team members is on call 24/7. So even in the middle of the night, if we are getting a call about those cases, we will be aware of it and we will notify the community and start the contact tracing period as soon as possible to protect our community.
Any questions from the Windsor Star? Windsor.ca?
Yeah, what do
Go ahead.
Sorry, I had a question when you start.
Yeah.
The push to keep people home after traveling, does that apply to healthcare workers?
Well,
They're not staying home.
Well, the recommendation is also for the healthcare worker, but recognizing that there are some healthcare workers who are very specialized in what they do and their services are critical for the operation of the hospital. And if any of those workers are identified, we have given very clear directions to the hospital to ensure the safety and well-being of the staff and also their patients, and what additional measures they can put in place to ensure that these individuals, if they become symptomatic, they can be immediately self-isolated. Those are all happening at the individual basis, but our recommendations and guidelines clearly lay out some of those conditions to ensure the safety and well-being of the staff and also for the community.
Windsor.ca, any questions? Any other questions from anyone?
There's
One more question. CTV?
To follow up on the third case as well, where you were talking about how you've done the contact tracing and all that. In this case, you can confirm or the health unit is satisfied that there was no community spread or risk of community spread with this person coming back and forth?
Well, as I said, most of these individuals were on self-isolation even before their test became positive. So it was just further reinforce the message of keeping people following the guidelines, because even if later on you develop symptoms, while you're self-isolating, the likelihood of you infecting anyone else in the community would be very, very low. So the message is still self-isolate if you are a returning traveler. Self-isolate immediately if you develop symptoms, because that's the only way you can protect your own family, your whole community.
And the business closures that are taking effect tonight, I think there was kind of some discussion that they saw the list. I think it's 64 items long, and people are kind of saying, well, what is closed? Do you feel the directive from the province is satisfactory, is enough, or is achieving the objective?
Well, I guess it can get more clear than that, because I think they are laying out some of the bigger parameters on which businesses are there, and businesses will have to look into which category they fall into, and then make some of those closures. And in the future, we may see more guidance on that. And if we are receiving any complaints, I think our health inspectors are capable of going and doing that risk assessment as well and can provide directions.
No more questions. Thank you, everyone.
Thank you.